Opponents are spreading the idea that the president's plan will encourage euthanasia. Most recently, Sarah Palin.
Sarah Palin on Facebook to the point of the opposition. This is what she writes. The America I know and love is not one in which my parents or my baby with Down syndrome will have to stand in front of Obama's, quote, death panel so his bureaucrats can decide whether they are worthy of health care. Such a system is downright evil. There's the rhetoric. There's also the question of what's true and what's false and what people are arguing about this notion of a death panel.
Yeah, again, that's crazy. If the crazies are attacking the plan because it'll cut off Granny. And that's simply not true. That simply is not going to happen.
She's not going quietly.
No, and that's a low blow. That's not an accurate assessment of what this panel is, but it definitely will get her attention.
Jessica's right. It does get attention. It's not the way to debate this bill, and it's another example of Sarah Palin having difficulty figuring out how to enter into a serious debate about issues.
Yeah, and people are being whipped up on that issue right now, and they think that essentially euthanasia is going to be allowed based on this health bill. Obviously, it just doesn't pass the Joe Sixpack test. I think even Sarah Palin would acknowledge.
I don't know that he's ever been called Joe Sixpack, but Howard Dean, who was a practicing physician in the state of Vermont, the longtime governor of the state of Vermont, and then the chairman of the Democratic National Committee, was asked about Sarah Palin's Facebook posting a bit earlier this morning.
Can I get your reaction to Governor Palin's comments on her Facebook page?
About euthanasia, they're just totally erroneous. She just made that up. Just like the bridge to nowhere, she supposedly didn't support. There's nothing like euthanasia in the bill. Look, I've practiced medicine for a long time, and of course you have to have end-of-life discussions. The patients want that. There's nothing. Euthanasia is not in this bill.
A silly distraction, a Dean Palin debate?
No, I think it actually is a bigger part of what we were talking about before, which is that is a serious allegation that's been out there for weeks, and the left has sort of let it build and build on talk radio and other venues that the president is pushing euthanasia. It's a pretty absurd argument, but it hasn't really been countered until now.
The president called that outlandish.
Yeah.
He said the words...
Why don't you put up what Dr. Zeke Emanuel said? Because Dr. Zeke Emanuel, who's the chief advisor to the president and brother of the chief of staff, said in writing...
He's not the chief health care advisor. He's written 3 articles between 1996 and 2008 that include some of those phrases.
Include
but those
communal
phrases
standards.
Those phrases appear nowhere in the bill. The only thing in the bill... Let me just explain what's in the bill and then get you to respond to that. The only thing in the bill is that it would allow Medicare to pay for what they say is voluntary counseling on end-of-life issues.
You're asking us to trust the government. Now, I'm not talking about the Obama administration. I'm talking about the government. You're asking us to decide that we believe that the government is to be trusted. We know people have said routinely, well, you're going to have to make decisions. You're going to have to decide. Communal standards, historically, is a very dangerous concept.
It's not in the bill.
But the bill's 1,000 pages of setting up mechanisms. It sets up 45 different agencies. It has all sorts of panels. You're asking us to trust turning power over to the government when there clearly are people in America who believe in establishing euthanasia, including selective standards.
Well, look, this is something Newt and I agree on. I don't want somebody in between the doctor and the patient. I don't want the possibility of losing your health insurance. I don't want people setting standards and denying care. That's all what we have now under the private health insurance system. That's what happens. Look, I practiced for 10 years. My wife is still practicing. Never once did I have a Medicare bureaucrat tell me what I couldn't do for a patient. But all the time we have bureaucrats from the insurance companies calling up and saying we're not going to cover this and we're not going to pay for that and we're denying coverage of that. The system we have now is broken. We need to fix it. I think giving the American people some choices about how to fix it makes sense.